what are oxalates?
We don't need oxalates.
What does an oxalate managed diet look like?
They're removed through the kidneys.
What do oxalates do?
Oxalate managed diet, not a no oxalate diet.
Low oxalates that are also great for kidneys. Hi, everybody, and welcome to the Kidney Coach YouTube channel. I'm joined again today by the beautiful Lindsey Zirker from the Kidney Nutritional Institute. So, Lindsey, thank you so much for joining me again. I really always appreciate you being on here and your wisdom and your time. So, thank you.
Well, thanks for having me back. Happy to be here.
Yeah, it's awesome. So, oxalates, let's just dive straight in. So, what are oxalates and why should people with kidney disease even know what this word means?
Yes. So oxalates, they are a substance that are found in plants, and in plants, they serve a really helpful purpose. They help regulate minerals and help protect against external issues that could harm the plant. And but for humans, it's considered a non-nutrient. We don't need oxalates, and they just happen to be in a lot of plant foods that we eat. And so for kidney disease, we like to pay attention to them because certain conditions can arise that can make people higher risk for absorbing more oxalates, and that can increase your risk of kidney stones. And then we've also found that for people who have PKD, that reducing oxalate intake may help to reduce the risk of cyst growth, but also we've noticed a lot of different type of symptom improvement, like flank pain and joint pain and things like that.
Amazing. So what do oxalates do? So obviously I think we call them an anti-nutrient, right? Because they're really for plants and not for humans. So tell me, what do oxalates do and how do they interact with the body that makes them potentially detrimental? And why do some people handle them fine and other people don't?
Yeah. So when you eat a plant that has oxalates in it, the food will be broken down in the gut and the oxalates are released from the plants. And in the gut, some oxalates might bind with certain minerals like calcium. And that means that people aren't going to absorb those bound oxalates very well. So they'll pass out through the stool. But free oxalates are absorbed and then they're removed through the kidneys, through the urine. And sometimes people can be more prone to absorbing oxalates if they have some gut issues. One of the biggest ones is if you aren't digesting your fat very well. And this can happen if you've had your gallbladder taken out, or sometimes if you've even had you're on medications or other things that reduce your stomach acid, that will reduce the amount of enzymes to help break down your fat. And what happens then is if you have all this extra fat that isn't being broken down, then it will actually bind up the calcium. And so the calcium isn't really free to help bind up those oxalates. This can also happen if you've had any type of GI surgery, like for weight loss, like gastric bypass, things like that.
So what sort of foods and what does an oxalate managed diet look like? What would someone be having to be prepared for to do that?
Yes, that is such a good question. So I always remind my clients that it is an oxalate managed diet, not a no oxalate diet, for a couple of reasons. One is that oxalate data is really kind of sketchy. There's a couple of reasons for this. Oxalate in amounts in the same type of food can be different based on a lot of different environmental factors, like the type of soil, the level of ripeness when it was picked, the weather conditions, but also the testing method of the oxalates can vary. So you might see on one oxalate list that a food is high, and then on another one it's low, and then it just gets like really frustrating. And when you're trying to, be really on top of your health, you're thinking, I don't even know who to trust anymore. So we just want to acknowledge that sometimes the data is conflicting and challenging. And so that there's multiple ways to manage your oxalate intake, and limiting your intake of higher oxalate foods is one of those ways.
Yeah, great. And are there Foods that you can enjoy in abundance, knowing that they're really low oxalates that are also great for kidneys. I know like blueberries is one of my favorites for kidneys and has next to no oxalates in there. So are there other foods that you recommend that you go for glory? We know for sure, doesn't matter on the weather, the season, if they were biodynamic or picked on the full moon, or if someone's chanting as they were done, it's going to be low oxalates.
Right.
And are there foods where people listening, they're like, oh my goodness, what can I eat? Is there something out there which you can go, you don't have to worry about this part?
Yes, absolutely. So like if I have clients that are just like, oh my gosh, like almonds are my go-to snack, what do I do now? Macadamia nuts and pecans are a really good substitute for that. For like sesame seeds or chia seeds, a smaller portion size, or like flax or sunflower seeds, those are really good options. In place of some of your favorite beans, you can use like kidney beans or lentils or split peas, or chickpeas. And then potatoes, you can peel them, and that takes off a lot. And especially if the other added benefit of that is if you're not buying organic potatoes, if you peel them, that helps get rid of a lot of pesticides and chemicals as well. So double bonus. Radishes and jicama, those can be really nice substitutes for potatoes, especially if you're cooking them in like soups or stews, which we're kind of moving into that time of year when you want that. I didn't believe it when I saw you could substitute radishes for potatoes in a soup. I thought that is insane.
When you just said it, then I was like, radish soup for a potato. So I'm going to have a radish and leek soup rather than a potato and leek soup. But really?
Yeah, it does. I experimented on all of my friends and they didn't even know it. And they thought these are great potatoes. So
wow, okay, you have it there, folks. You can use radishes instead of potatoes. It comes straight from Lindsey. So
that's right. Yeah, my friends all took one for the team on that happily because it worked out.
Okay.
Yeah. Instead of beets, to have colorful like salads or whatever, carrots or cabbage or bell peppers, usually the amounts we eat those in seems to be a really reasonable substitute. So
what about instead of spinach? Because I know
yes,
smoothies if you go there.
So kale is a really nice substitute, and then other types of just like lettuce. And then if you like something a little more spicy, arugula can work really good as well. And then cabbage. I didn't know if
arugula was high or not. So, okay, that's good to know. Okay. Lindsey, thank you as always for your expertise and time and knowledge. I really appreciate it, and exactly how you put things forward for people to understand nice and easily. It's always greatly appreciated. If you have decided that you absolutely have an oxalate issue and you would like to work with a practitioner, you can head over to the Kidney Nutritional Institute and click on About Us and Practitioners, and you'll find all of Lindsey's details there. I'll put that in the show notes below. If you want to know more about what we do, head to www.kidneycoach.com. And if you want to be informed every time we put out a video, make sure you hit subscribe. And if you have any comments or you'd like Lindsey or me to interview anyone on any specific areas, make sure you leave some comments below and I will get back to you. Hey, Lindsey, thanks again. Always appreciate it. And I'm sure we'll get you back on again. I think we need to, there's a few more things I want to pick your brains about, so we'll have to do that.
Thanks so much for having me, Fiona. It's always great to chat with you.
Yeah, you too. All right. You enjoy the rest of your evening. And again, thanks for being part of our community. We will see you next time. Bye.